Good afternoon to everybody who's joined us today. It is 12:30, so I will go ahead and get us started with some housekeeping and introductions. Welcome, my name is Sarah Sims, and I'm the Assistant Director of Professional Development for the Brown School here at Washington University in St. Louis. Thank you so much for joining us for today's Open Classroom series. Open Classroom is the Brown School's virtual and free professional development series. Beyond Open Classroom, we are the largest provider of continuing education units in Missouri. So if you're looking for CEUs or want some deeper learning experiences, I invite you to check out our website, brownschool.wustl.edu/professional-development. We offer workshops year-round on nearly a weekly basis with many different topics, and we would love to have you. So for today's Open Classroom webinar, just a couple of housekeeping items. First, this is a webinar format, which means that if you are joining us online, we can't see or hear you, but we can and do want to engage with you through the chat, which has been turned on. So we welcome your hellos, your comments, and also your questions, which hopefully we should have time for some questions at the end of today's panel. Also, the recording will be the program today is being recorded, and that recording will be posted tomorrow on our website, on our Open Classroom page, as well as our YouTube channel. So if you have a colleague who missed it or you want to rewatch later, you can access that and share. Finally, I just want to acknowledge that this is a hybrid program today. We have viewers online, and then we also have attendees here at the Brown School. And so if you are in person, please use the microphone when you are speaking so that the audience online can hear you, including if you're asking a question at the end. And then if you are online and you want to engage, please use the chat and we will do our best to relay your questions to the in-person audience and presenters. So that is it for housekeeping. So now I would like to introduce and welcome Dr. Praskovia Nubunya, who is an assistant professor here at the Brown School. And she's going to introduce our program for today, the topics, and the panelists. So Dr. Nubunya, the floor is yours. Oh, I think you might still be on mute.
Thank you. Good afternoon, good evening, everyone on Zoom. I welcomed everybody for joining us today for our ACHEIVE speaker series. And before I go into the details of today's presentation, I would like to, first of all, congratulate our ACHEIVE team and the Brown School community on completing a successful conference last week. So everybody did an excellent job. Thank you so much. We welcomed many visitors from the US, from Uganda, and we had very important talks from our Minister of Health, but also from the university leadership. So thank you for those who joined us. And we also witnessed the graduation of one of our other training programs, GRF. So congratulations to all those trainees. So our next speaker series will be in May, and it will focus on humanizing first intervention development with a community engaged focus to support health equity by Dr. Sonia Richardson. It will be on May 7th from 12:30 to 1:30. So please, if you're available, join. I think it will be on Zoom. And for today's speaker series, which is the second last, we are thrilled to have 3 visiting scholars at WashU as part of our ACHEIVE training program. So the ACHEIVE training program focuses on increasing dissemination and implementation in data science research capacity in order to address global health disparities affecting children, adolescents, and their adult caregiver. So this program is really designed for medical doctors and postdoctoral trainees from diverse backgrounds in the US, especially groups underrepresented in biomedical, behavior, clinical, and social sciences, as well as trainees from 6 countries in Sub-Saharan Africa. So we recruit in the US, but also from Ghana, Kenya, Rwanda, Sierra Leone, South Africa, and Uganda. So today we have 4 presentations, right? Okay, I don't know why I'd say 3. We have 4 presentations, and these individuals, wonderful scholars, have spent a lot of time to do their work, to do their research. So yeah, excited to hear what has transpired in the last year. And to introduce the trainees will be Dr. Neil with their bios and specific topics. So thank you.
Thank you very much, Dr. Praskovia, for those remarks. So welcome to our session today. So I will be moderating that. I guess I need no introduction here. And, oh, what did I do? Okay, clicky. Okay. Yes, so we have 4 speakers today. I will not introduce them at once, so I'll introduce them as they come up. And so as you can see, we have Dr. Anita Kabarambi, we have Dr. Scovia Balinda, and then Dr. Rachel Nakuluma, and Dr. Nsembizile Nkosi. So 4 of those will be presenting their work today. Dr. Prosi has already talked about ACHEIVE. So just for those who weren't able to catch it, you can read it there and see what ACHEIVE is all about. I just want to add to that for those who basically, this is for people who are interested in various topics, including child and adolescent and their caregivers, parenting, HIV and AIDS, mental health, cancer and nutrition, environmental health, and other areas. And so these, the mentors and people who are doing research as part of ACHEIVE program are primarily interested and focused on some of these topics that you see listed on the slides here. And these are our partners across the US and across Sub-Saharan Africa. Dr. Prosi mentioned earlier on, we have trainees from different countries. You can see all of those represented here. WashU obviously is the lead institution here, from NYU, Boston College, University of Illinois, Chicago, Makerere, and the various universities that you see there. And for those of you who are interested in figuring out or knowing what each of the ACHEIVE trainees are doing, they actually have a blog. And hot off the press today, Dr. Anita, and I read it, talked about, what she's been doing while she's here. She's talking about the mentorship and really the opportunities that she's had here. And actually, if I can take a minute, since I have the mic here, as an alum of this program, I can tell you that we didn't have the blog at the time, but I can tell you that it's been really a very great opportunity for me. I've gotten a lot of mileage out of it. So for those of you who are considering this, please think about this in the future. So now we will move to our presentations, and we'll start with Dr. Anita Kabarambi, and I will introduce her as our colleague. Matthias pulls up our slides. So Dr. Anita is a medical doctor trained with the medical degree training with the Bachelor Degree of Medicine and Surgery from Makerere University, I understand one of the top universities in East Africa, maybe the continent. She also has a master's degree from one of the other top universities from London School of Hygiene and Tropical Medicine. She has more than 10 years of experience conducting research in areas of HIV, epidemiology, and intervention studies, mainly focused on HIV prevention, oral PrEP, HIV vaccine trials, and microbicides. She currently is a research director at ACHEIVE in our Uganda office. ACHEIVE, as you know, is part of Washington University, the Brown School here, where she oversees the implementation and planning of all of our research studies, and she does a fantastic job at that. Her research interest is really adolescent health, implementation science, HPV vaccines, uptake, and HIV prevention and treatment outcomes. Please help me welcome Dr. Anita Kabarambi.
Thank you so much, Dr. Nihal, for that introduction. I'm Dr. Anita Kabarambi. I'm a Chief Fellow from Makerere University. And for my ACHEIVE project, I conducted a pilot study to assess the impact of public health messaging on HPV vaccination uptake among adolescents and young women living with HIV in central Uganda. My motivation to do this study stems from my previous involvement in a vaginal microbicide study. And during that project, we discovered several cases of precancerous lesions that the women were unaware of. So this experience has fueled my determination to explore avenues of raising awareness and HPV prevention through vaccination among vulnerable populations. Before I move on with my presentation, allow me to recognize my mentors who have really played a key role in this journey. These include Dr. Nixon Nyonzima, Dr. Fred Sewamala, Dr. Jean Hanleth, and Dr. Silva Michelle. I want to acknowledge that Dr. Fred and Dr. Jean are present in this room. I truly appreciate that support. That's going to be the layout of my presentation. So why should we be thinking about HPV vaccination? Cancer of the cervix accounts for more than 300,000 preventable deaths annually, and 85% of these occur in low and middle income countries that are also heavily burdened by HIV. We also know that women who are HIV positive are 6 times more likely to die of cancer of the cervix compared to their HIV negative counterparts. And cervical cancer is very common among the Black women. We also know that 95% of cervical cancer cases are attributable to human papillomavirus, which is also prevented through vaccination. The World Health Organization has licensed a number of vaccines to be used against HPV. And in Uganda, this vaccine was rolled out to the whole country in 2015. And they are targeting schools to do this vaccination. So they meet the children at school. But one thing that is interesting to see is despite the readily available vaccine, and I know it's free of charge, we still see that the demand and uptake for the vaccine is very low, ranging from between 17% to 49% for the first dose and 13% for the second dose. When you go into the literature, most of the papers are pointing to look at why the uptake of this vaccine is low. Most of the papers are pointing to a lack of knowledge. And that is why I was moved to look at the following aims in my study. I had 2 aims for my study, and the first aim was to assess the knowledge levels regarding cervical cancer, HPV vaccine, and the underlying reasons for both uptake and non-uptake of HPV vaccine among girls aged 10 to 24 years and living with HIV in central Uganda. For my aim 2, I wanted to test the feasibility, acceptability, and preliminary impact of information sharing, education, and communication interventions on HPV vaccine uptake among this population. I used an experimental study design, and I included 4 clinics from the Greater Masaka region, and these were randomly selected. And 2 of these were randomly assigned to treatment arm and 2 to the control arm. I recruited 100 girls and 50 in the control arm and 50 in the treatment arm. We included HIV positive girls who were aged 10 to 24 years and were aware of their HIV status. For my second aim, we included HIV positive girls aged 10 to 24 years who had not received the vaccine at that time. We excluded all those who could not comprehend study information and who had impaired cognition. For the control arm, we placed posters about HPV vaccination on the walls of the ART clinics. And in that picture, that is a poster that I put up at one of the clinics. And these posters were received from the Ministry of Health, so they were approved to be used in the country. Then for the treatment arm, on top of placing posters about HPV vaccine on the walls at the ART clinics, we conducted a 1-hour training session discussing with girls living with HIV and their caregivers the burden of cervical cancer, the causes, HPV vaccine information, including where to access it. And these trainings were conducted by the ART clinic staff that were engaged in cervical cancer screening. So I also distributed brochures with the same information to all the people that attended these training sessions, and I left copies at the clinic to be distributed to anyone that was interested in having this information. We decided to collect data at 2 time points, baseline and 6 months post-intervention initiation. And those are some of the constructs that we looked at. So we had questions on demographics, family background, sources of information, knowledge about cancer of the cervix, perceived susceptibility to cancer of the cervix, perceived seriousness of cancer of the cervix, knowledge about HPV vaccination, attitudes about the vaccine, perceptions, barriers, and acceptance. And for our outcomes, we want to see the changes in girls and young women's knowledge, attitudes, and behavior in regards to HPV vaccination uptake. Then we also want to see uptake of the first and second HPV dose at 6 months post-intervention initiation and time from intervention delivery to uptake of the first dose. So prior to collecting my data, I introduced the study to the different clinics where I was going to work, and I just wanted to share just a few attributes that I got from the clinic. The different clinics that I visited. So the ART in charges were very excited about the project, and they kept mentioning, we've been focusing on the adults, but it's very good that you're thinking about the young ones, and they've never thought about it that way. So they were very excited about the project and promised that they will also start engaging these young girls to get this vaccine. I didn't have any major challenges. I actually didn't have any challenges doing my work. And I just wanted to share why I think this was a smooth path. I had a very committed team. And in that picture, those are my research assistants, 2 medical officers, and 2 nurses. They were very passionate about the project and were very excited to go to the field and collect the data, and we're very excited to see what will come out of this study. I got continuous guidance from my mentors. As you can see, I have 2 of them in the room, which is very, very good and important to me because they really believe in what I'm doing. And they've supported me right from the time I was conceiving this concept, all through the process, even up till now. Also building on existing systems created by one of my mentors, Dr. Fred Sewamala. He's doing a lot of work in the Masaka region, so introducing me to these facilities was very key for me. I found it easy to penetrate the clinics and also to get approval from IRB, because these are things that have been done by the ACHEIVE team. What's my way forward? I'm working on a manuscript from my baseline data. I hope to do my 6 months post-intervention interviews in July. I plan to disseminate my findings at conferences and meetings, and also to identify areas that need further research and apply for further grants. One last thing that caught my attention as I was doing my study, when we were inviting caregivers to come for the intervention delivery, we never specified the gender, but it was interesting to see that we never had any man come for these sessions. So I kept asking myself, where are the men? And just reflecting on my master's thesis, where I looked at the men's attitudes towards the piverine vaginal ring and how they played a key role in deciding how women use sexual reproductive products. I feel not having the men attend these meetings is really something that is strange, because at the end of the day, they want to be the decision makers, and they are the decision makers, just like I found in my study. So I'm thinking next steps to find out where the men are. Thank you so much.
Thank you, Dr. Anita. Hopefully you figure out where the men are hiding. So that'll be good. So now we will move to our next presentation, and it's by Dr. Scovia Mbalinda. Dr. Scovia is a nurse midwife and holds a PhD in medicine, a master's in population and reproductive health. She's a lecturer at the Department of Nursing at Makerere University and coordinating graduate students' studies at the department. She's a fellow of the Sub-Saharan Africa Foundation for Advancement of International Medical Education and Research, Regional Institute in Cape Town, South Africa. Her research interest is very vast, includes reproductive health, maternal and child health, adolescent health, medical education, and health systems. You've got quite a heavy load to lift. Scovia worked with adolescents for over 10 years, providing care and conducting research, and has published a number of papers in this area. Under this ACHEIVE training, so her training, she is interested in researching on how HPV vaccination uptake has similar threats to Dr. Anita. Among adolescents living with HIV can be improved among adolescents with adolescent populations in Uganda. This work builds on her previous work from her dissertation studies as a principal investigator to study reproductive health related to quality of life, perinatally HIV-infected adolescents in Uganda, and her work really on transitioning adolescents from adolescent clinic to adult clinics. Welcome, Dr. Scovia.
So thank you so much. Like they've said, I'm Dr. Scovia Mbalinda. And like my colleague, I acknowledge my mentors and Professor Miriam Nakalembe, Agre, Professor Jean, we appreciate your presence, and Dr. Michelle Silva. So like my colleague has just mentioned, I'm not going to dwell a lot into the statistics, you've heard them. So I'm just going to jump into this is the background that I'm going to use to present. And like my colleague has mentioned that human papilloma virus is the most common viral infection in most of the reproductive tract system. And looking back home, it comes second to breast cancer. So it's the major cause. And we've seen that vaccination can prevent these conditions to improve the overall health for these particular adolescents. And like she has said that the uptake is quite low between 17 to 49. But what I have to mention that these statistics are for all adolescents. It is irrespective whether you're HIV positive or negative, and we've seen it is quite suboptimal. So it was against these statistics. And because of my work in adolescent, I really wondered what is the uptake, if the uptake in this particular population of all adolescents is this low, what would happen within this particular population where I work. And just to give you a brief, and probably my colleague has mentioned it, like for example, HIV really compromises immune response. And when you have HPV infection, it increases, if you're HIV positive and you get HPV infection, it increases the risk of developing cancer, and of course your progression in HIV also increases. So if you have both of them, then this is going to probably worsen your health outcomes and creating complex interaction, which we are seeing in most of the adult women. So we set out to assess the uptake of HPV vaccination among female young people living with HIV, attending one of the district hospitals in Uganda. And my work was informed by this COMB model, which looks at behavior change. Behavior change here, we are looking at uptake. So you really need to have the capability to change behavior. So looking at knowledge and skills, which she looked at, and also looking at the opportunity, the environment around you, the barriers and facilitators, and what would motivate you to change. And I followed this model to really guide my studies. So these were my specific objectives. So to look at the prevalence and factors associated with HPV uptake, this was a cross-sectional study. We looked at participants between 15 to 19. So as far as we are now, before I came here, we had just completed our data analysis. And data collection right now I'm analyzing, and we are looking at the paper that we are going to be writing from this particular objective. The second one was mainly looking at exploring facilitators and barrier, and this was a qualitative research. We had participants, the young people, the girls. We looked at the caretakers and guardians, and also healthcare workers. So one thing I have to mention here, initially also going in, I looked at caretakers, and of course, those who are present were women. But I was informed in the clinic, I think one of the guys said, "Why don't you invite men?" And I said, well, since my protocol is open, can you organize that? And actually, after a week when I went back, I did get the men. So the men were there, but I think they needed to be invited. And I had 2 group discussion with these people. And after these 2, and looking at the barriers and facilitators, it's going to inform my third objectives, which is going to be mainly prioritizing the intervention from 1 and 2 objective. And this one, I'm going to be doing it in May when I go back. So just a snip on the results. The analysis is not yet done. So what I'm presenting are the preliminaries. So the population, 63%, were between 20 to 24. And one thing I want to bring to your attention, that most of these young people, over 60% were out of school. But remember, back in Uganda, the focus is school immunization. So this is something that we have to think about, because majority of these are out of these. And also looking at this particular population, actually most of them had received vaccination. But when you look at HIV positive, it's not only the first immunization that is very important. For HIV positive, you have to take 2 or more vaccines. Whereas the guidelines for WHO, which came out in 2022, for those who are immune competent or those who are HIV negative, 1 vaccination is enough to give them a good protection. But for those who are HIV positive, you need to take at least 2 and 3 if resources allow. So looking at these, yes, 68% of them took the first vaccination. But when you look at the second and the third, you can see most of them stopped at the first vaccination. So these are from my field notes, just to share with you the barriers and facilitators. Of course, barriers was lack of awareness and information. There was a lot of misconceptions and myth, especially people thought that the vaccines were expired. They lacked trust in these vaccines. Most of the women thought these vaccines would cause infertility and sometimes death. And of course, we saw parental influence. Most of the parents refused these children from taking these vaccines, and of course, culture and religious belief and the healthcare providers, and of course, fear of the side effects, or due to immunization, most of these girls didn't turn up. But of course, the facilitators that were highly pointed out were information about HPV vaccine, peer influence. In Uganda, we have the YAPS group. The YAPS have done quite a good work, and they think this can influence, support from the parents. And also they said, since HPV is free and readily available, that could facilitate, and of course, accessibility. And they really thought recommendation from the healthcare workers and religious leaders. So when we sat with these people, we looked at the strategies, and they said, well, to make sure that these girls, because all of them, after giving them the information, they believed this was a very good thing to do for these. Most of the parents refused to immunize these children because they didn't have a lot of information and knowledge about the vaccine. So they thought public health campaigns would really do well to improve integration of HPV in HIV care would go a long way. Using of testimonies, those who are immunized, but later they became pregnant, to come and give testimonies to these young people. And of course, enforcement, I don't know how that could happen. Including HPV vaccination in routine, it has not been done anywhere, meaning that they could get it earlier when they are young. That was suggestion. And of course, males really said they should involve them because they make a lot of decisions. And of course, continuing immunization and education, training providers and caregivers. So what is my way forward? So after here, after analyzing for objective 1 and 2, I'm going to go back to the clinic to do a bit of prioritization of what we think from the people, what would be the best contribution in terms of developing an intervention? Could it be knowledge like you cited, or could it be the parental? But I cannot decide that. Of course, we are going to do this through a workshop. So of course, I've already identified about 3 papers that we would write up after doing this work. And these will be published. And of course, we are going to develop and adapt an intervention depending on the workshop that will come out and apply for grants. Acknowledgement for the funders, the principal investigators, Washington University, for giving us this opportunity. Of course, where I work and achieve leadership, my mentors, one of them is here. And of course, from the Mityana General Hospital, and the study participants. So thank you so much.
Thank you very much for a wonderful presentation, Dr. Scovia. And next, so just to give you some orientation, so we'll have these presentations and we'll have some quick Q&A after this, so you can hold your questions. That's why we're going with that, as taking any questions. So now next is Dr. Rachel Nalunkuma. Dr. Rachel is a practicing medical doctor and a research associate at Mengo Hospital in Kampala. She holds a Bachelor of Medicine and Bachelor of Surgery from Makerere University. And she also holds a Bachelor of Science in Medical Sciences from the same institute. With over 6 years of experience in research and on health, Dr. Rachel has made significant contribution to the scientific community, as evidenced by her publications, about 10 publications that are indexed in PubMed and Google Scholar. Throughout her research career development, she has gained a great passion for infection prevention and control and adolescent health. Dr. Rachel is particularly committed to tackling the issues of stigma among HIV-positive adolescents in Uganda through an innovative approach that aims to promote adherence to antiretroviral drugs and also empower their independent drug administration. So by so doing, she aims to improve their health outcomes to foster greater self-reliance among them. So Dr. Rachel, you're welcome.
Thank you so much. Good afternoon, protocol observed. I'll go straight into my presentation. So for my ACHEIVE fellowship, I set out to determine the effect of the facility-based group model of the differentiated service delivery on stigma and adherence among adolescents living HIV in central Uganda. So I'll take this opportunity to acknowledge the ACHEIVE directors, Professor Fred Swamala, Provost Mary McKay, Professor Noel Nakasuja, my mentors, Professor Pauline Diachka, Dr. Proskovia, and Dr. Elvin. I also acknowledge my co-authors who have been there for me throughout this journey, Dr. Edith Namlema, Dr. Andrew Marvin, and Dr. Rachel Nakandi. So jumping straight into my presentation, I'll give a few definitions and abbreviations to make everything clear for you. So when I talk about the differentiated services, these are services that are centered on the needs of an individual or a group of individuals living with HIV. And when I talk about facility-based group model, these are support groups of stable or unstable clients based in the facilities that may be used as avenues for peer support and art refills, and these are led by peer leaders. Yeah, you'll find the word art within my presentation. It basically means antiretroviral therapy, and then the DSD means differentiated service delivery. So a brief background about HIV endemicity. It's known that it's prevalent in the Sub-Saharan Africa with about 1.4 million Ugandans living HIV as per 2021. And of these, 170 adolescents aged between 15 to 19 were living HIV. We all know that optimum adherence greatly improves on their quality of health. However, stigma, among other barriers, impacts on the negative adherence levels. Luckily, through research, implementation of strategic interventions to overcome these barriers is ongoing. So in 2017, the Ugandan Ministry of Health, in collaboration with PEPFAR, PEPFAR means President's Emergency Plan for AIDS Relief, embarked on the implementation of the differentiated service delivery model and the management of people living with HIV. So this differentiated service delivery model scheme has two main components, the facility component and the community component. So specifically, I'm looking at the facility component, looking at the facility-based group model. So the facility-based group model cares for adolescents living with HIV, and services that are provided to these adolescents includes peer support, viral load monitoring, nutrition education, and financial literacy. So that's a brief slide showing the details about the differentiated service delivery model with a dashboard that is accessible to everyone to read about the various components. So for my study, I have three specific objectives. The first objective, I set out to determine the level of stigma among adolescents living with HIV and a facility-based group model in urban versus rural HIV clinics in central Uganda. So to generate data for this objective, I'll be using a cross-sectional study design, utilizing a 10-point HIV stigma score questionnaire that has been validated among adolescents living HIV in Kenya. So for my second objective, I set out to evaluate the effect of the facility-based group model on adherence among adolescents living with HIV in central Uganda. So here we're going to compare the urban and rural HIV clinics taking years of 2021, 2022, and 2023. So to generate data for this objective, I'll be using a retrospective review of medical records, and also I'll be using a 3-item self-reported adherence scale. So thirdly, I also explore their lived experiences towards a facility-based group model in reducing stigma and enhancing adherence among adolescents living HIV in urban and rural HIV clinics. So I'll be using the qualitative approaches, utilizing the in-depth and the key informant interviews. So far, the milestones that I've achieved, I was able to get my RB approval. I did also receive administrative clearance from all the 4 study sites. I submitted for approval to the Uganda National Council of Science and Technology. I did train my 4 data assistants. So the way forward, I'm still waiting for the approval from the Uganda National Council of Science and Technology. Once I receive that, I embark on data collection. After analyzing the data, I'll be writing up my manuscript that I'll submit for publication. And currently, I'm looking out at scholarship opportunities for my master's degree. So lessons learned throughout this fellowship. I've learned how to embrace and integrate the wisdom of multiple mentors. It's not easy. I've also learned how to multitask. I've gained self-confidence, and I've also learned how to document entry. So those are some of my references. And truly, I acknowledge all the Washington University, Mengo Hospital for allowing me to pursue my fellowship alongside my medical practice, Fogarty International, Makerere University, and the ACHEIVE, and everyone has been there to support me. I really appreciate. Thank you.
Last but certainly not least, we have Dr. Sebenzile Nkosi. Dr. Sebenzile Nkosi holds a PhD in psychology from the University of South Africa. She works as a senior scientist in alcohol, tobacco, and other drug research unit of South African Medical Research Council. She also holds a research associate position with Rhodes University and University of Johannesburg. Our research interest is in men's health, specifically the role of gender norms in men's vulnerability towards health risk, including violence, substance use, and other mental health issues. Our current research focus is interpersonal violence among male intimates in correctional facilities. Sebenzile has considerable research experience and has worked on multiple research projects of varied methodologies. She has also co-authored a number of peer-reviewed published papers, published in international journals. Please help me welcome Dr. Sebenzile.
Good afternoon. I'm honored for your presence here. So as Dr. Niall has indicated, my name is Sebenzile Nkosi, and I will be presenting to you my work that I've been doing while doing the ACHEIVE training program. The title is Interpersonal Violence Prevention at Juvenile Correctional Facilities in Gauteng. This is a region in South Africa, examining policies, guidelines, and practice. So I want to start off by acknowledging the people behind this work, people who have been very supportive. Thank you very much to those people. And then also I want to acknowledge Fogarty International Center for the funding of my fellowship as well as my pilot project. So to go into it, so some background to the work. So correctional centers are known to have high rates of interpersonal violence. And this poses a dilemma in that actually these facilities are meant to be providing safe custody of inmates so as to enable their rehabilitation, but often this is not the case. People are exposed to high rates of violence, and this negatively impacts mental health. We know that violence exposure is linked to post-traumatic stress disorders, linked to depression, as well as substance use. For offenders, it also has an impact on their rehabilitation, as well as peace and security in society. So we know that when people come into these facilities, they go back to society, and the violence that is learned within those institutions can then transfer into the open society. And then for young people, because of where they are in their developmental stage, it can also impact on their mental health in a long term. They are particularly vulnerable to mental health issues because of their precarious stage of development. And for young boys, or rather boys and young men, there's also the issue of them being enclosed in a violent institution where they are learning and forming identities. And that can influence how the things that they adopt as ways of being men, how they think about and how they need to be in society as men, and that can be harmful. So South Africa recognizes the United Nations Standard Minimum Rules for the administration of juvenile justice, and that actually has a special consideration for juveniles, that they need to be particularly protected from harsh conditions of incarceration. But the extent to which our policies in South Africa actually align to this protection is not very clear, as there is not much research that has been conducted in this area. So that brings me to my overall aim. So that is to examine current policies, guidelines, and practices of the Department of Correctional Services, so as to identify potential formulation and implementation gaps in the prevention and reduction of interpersonal violence within correctional facilities. And we use the policy triangle framework, which recognizes that there are multiple components that are involved in policy, that often the focus is content, but there's also context to consider, there's the process to consider, as well as the actors to consider. So we thought about all this, and that's the framework that we are using to understand our main goal and sort of like look at it within our sub-aims. So our sub-aims are various. The first one is really focused on document content, and it's to explore the Department of Correctional Services approach to violence prevention and reduction in correctional facilities. The second two are focused on policy formulation. So one is to explore the factors that influence policymakers' decisions in policy formulation, and the other one focuses on facilitators and barriers to formulating evidence-based policy strategies. And the last two are focused on implementation and practice. The first being to determine facilitators and barriers to implementation of the policy strategies, and the second one exploring the current practices that staff are using to prevent or reduce violence. So there are various activities that are related to these that we are going to employ to address our sub-aims. The first is reviewing policies and guidelines as indicated, and then we also hope to do in-depth interviews with policymakers as well as implementers and evaluators. And we will use thematic analysis to analyze our data. So in terms of where we are, with the policy review, we are at the initial stages of data analysis. And then for the others, we are at preparation for data collection. So I do not have any findings to present to you, unlike our Dr. Scovia here. She's really ahead. But yeah, hoping to have some data, and I hope I whet your appetites. But I want to acknowledge the journey of this program, and to just highlight that alongside the ACHEIVE pilot project, I've also been doing a survey, which is to determine the prevalence and associated factors with interpersonal violence. I'm doing this in Gauteng, the whole region of Gauteng in South Africa. And then I'm thinking about doing reviews, just doing some reading and checking what is out there in terms of like reviews around violence prevention focused interventions for correctional centers, as well as incarcerated youth. I also want to acknowledge that I've been through quite a few training programs. I want to highlight the ones that are on the screen, and that the implementation science focused training has really been something that I've really been taking on quite a lot, because that's the area where I felt I need quite a lot of improvement. So all this to say that I indeed, as my colleagues have indicated, we are all looking to expand our work, to grow in the area, and we are really looking to write up grants. So my next goal would be to write a K. Thank you very much for your attention.
Great work. And I want to steal how you did that star. That was cool. So I'm going to invite our panelists here. We don't have a lot of time, unfortunately, but we can explore further some of the discussion, some of the work that you've done. We have, I understand, about 9 more minutes. So I'll limit the questions to the most difficult ones. And I was going to go sit there, but I think in the interest of time, maybe I'll just stand here for now and ask each of you maybe questions. So you've already talked about your work, so we know relatively some of the work that you've been up to for the last year. Really, one of the things that I'm interested in right now, you've done this for about a year. How was participating in ACHEIVE? How has it really participating in this training impacted your training? Because I think one of the goals of ACHEIVE is to give you that boost and push to go to your next level. So how has this training impacted your research so far? And each one of you can take about a minute or so to answer that. And we'll start from Dr. Rachel on this, since you're closer to me.
Thank you so much. So I'm truly humbled that I was selected to participate in the ACHEIVE Fellowship. As an early career researcher, it has really grown my research base. It has enabled me to collaborate with various researchers. It has connected me to various mentors. I did travel to NIH, and I also traveled here. So I'm really grateful that I've been able to participate in this fellowship.
Thank you.
Okay, thank you so much. Like my colleague has mentioned, from my background, I've done research, and sometimes when you're back home, you're on other people's research, and it doesn't give you an opportunity to be the first author. So getting into ACHEIVE gave me an opportunity to do my own work so that I can be able to be the first author on some of these particular programs, on these particular papers. But of course, it has opened up a lot of opportunities and networking. I mean, we've had the pleasure, even before coming here, to work with people who have worked in HPV, like Dr. Jean, and they always point out here and there, and also sharing the work that they are doing in Zambia. And that has been quite beneficial, and also to open our eyes that you can actually aim higher than what you're already doing. And I do hope that with this experience, I will be able to apply for other grants as the PI.
Thank you.
Thank you so much, Dr. Nihal. I felt I needed to share this. I know it's 1 minute, but let me share.
Yes, please go ahead.
When I first came to the US in 2009, my host told me to just come with one dress, and that's what I did. So when I came in, they took me to a store where they sold clothes, and there were lots of clothes in that warehouse. I had never seen something like that. And I want to compare this to what I have found in the ACHEIVE training program. lots of opportunities. I just got lost in that store. I couldn't decide where to start from. And this is what I have found in ACHEIVE. Lots of opportunities to mentors. I have 4 great mentors. They've done a lot of work in the area of my interest. I just can't get enough of them. I have been exposed to opportunities for networking just during this visit. As in, they introduce you to several people, like it's too much. You can't finish it. And then exposure to, it has also exposed me to the world of research. I remember at our orientation, I just used to hear about, what was his name? Dr. Yes, Professor Fauci. It was great to meet him in person and have breakfast with him. Even if you gave me 100 years back home in Uganda where I was, I would never get to meet him face to face. But through ACHEIVE, I was able to meet him face to face. And I also had a chance to have lunch with the program director of the Cancer Institute. These are the people that decide where the money goes in your country. And having lunch with them, for me, was really humbling. And all this would not have been possible if it wasn't for ACHEIVE. So I still say the opportunities with ACHEIVE have really been immense.
Great. Thank you so much. Dr. Sebi.
Thank you. Thanks for the question. So for me, ACHEIVE has really solidified my niche area. I know I'm still growing in it, but basically this work comes from, it started with my PhD work. And when I started my research career, I was doing work in substance use, particularly alcohol and HIV. And I kept, because I have an interest in gender and gender norms, I kept sort of slotting in, and my mentor was great because she would always say, do you see an angle that you can, do the work and so on, and make sure that your interests are represented. So when I went into my PhD, I really sort of moved away from it. And it's nerve-wracking in a way because I'm moving away from my mentor. So I got started. And so by getting ACHEIVE and so basically it was a validation because it was, a whole host of people who believe that this work is important and it's fundable and it can, it's an area that can grow. So yeah, that's
great. And we are short on time here. If you can give 1 or 2 words advice to the other students, what would that be? Like something, hey, mentorship or whatever it is, just 1 or 2 words before we hand it over to, yeah. And I know we have some questions online. I don't know if we'll get to those, but 1 or 2 words, yeah.
Okay, I'll go first. I think the advice I would give is know what you really want. So that will also help you identify the right mentors to guide you all through this journey. For me, getting a mentor in my research career was like a groundbreaking decision that I took. And I really recommend that it's very important that you identify a mentor that can journey with you. Yeah.
Great.
Okay, so I'll go next. One thing I can tell them is to push themselves, not to be scared. Put yourselves there, believe in yourself. And secondly, determine your research interests because there's really a lot. And be open-minded, be optimistic. Yes, that's what I can say.
Thank you.
So from my perspective, it's about resilience and a lot of hard work that we've had less than a year But you know that we've done quite so much, and this is because the leadership was committed. They gave us some protected time, and we did work. So in most of this work, it takes much more than passion, but you have to be resilient and you really need to work hard.
Yeah, so mine is very similar to what's been said, so I will leave it.
Thank you very much. We have a couple of questions online, but I think we'll let, and they're both for Dr. Anita. They're around randomization. I think we'll let you directly respond to the individual after this. I think that'd be fair. But I wanted to take this opportunity to welcome Dr. Osge to do our closing remarks. Thank you.
I just want to invite everyone to give just one more round of applause to our amazing trainees. This is why we do what we do, to be able to host you and hear all the wonderful work that you're doing and hear about your next steps and, you know, watch you grow professionally. So it's very rewarding for us and very exciting. So thank you all. And with that, I would like to also thank our audience for being here, for all the questions that you haven't had a chance to ask, but I'm sure you thought of a lot of questions that you could have asked if you had the time. And I just want to remind you that we have one more speaker series coming up. So please stay tuned, keep an eye on your mailbox, and we will see you back in May.
Thank you all. One final announcement is that a recording of today's session will be made available on YouTube and our website tomorrow. So we hope that you will share that with your colleagues.